Yeah, go ahead and do that. All right. So, Dawn, let's get into the topic for today, which is teething. And there's just information I'd like to go over with everybody. You're just a wealth of knowledge in this area and how it relates to their baby and also to breastfeeding and everything else and what they're dealing with. And I know they're dealing with a lot. So, let's just, first of all, can we talk a little bit about what teething is?
Yes. So it's funny when I get asked what teething is, I can go very specific into actually what's happening with the mouth and what maybe a dentist might say, but this is the way that I define it. I define it as a process of growing teeth to help baby chew, swallow, and communicate.
Hmm.
And really that's what we do with our teeth if we think about that, right?
Yeah.
It's a way that we chew our food, so to decrease the risk of aspiration, which is food and liquids going into the lungs. It's a way for us to be able to put that food together into a cohesive ball to decrease the risk of choking, which all parents are afraid of.
Yeah.
And it's a way that we communicate. So as soon as the teeth start to erupt, you'll also see a lot of drooling, which we'll talk about too, but
Hmm.
you also start to hear more babbling and more sounds, and baby is starting to get ready to be able to communicate and be able to have those cute little goofy one tooth grins. And
Yeah.
we really start to see all of these social skills that start to emerge, as well as, feeding and communication. So when that's the definition of teething for me, is
Hmm.
when babies just really start to grow in this different capacity and becoming more adult like, because now they can chew and swallow and talk and really give those social smiles.
Mm. So would you say that, and it's such a specific thing when you start to see those teeth erupting, or not even erupting, but the swelling of the gums.
Yes, yes.
Would you say that's something for them to look out for? And I mean, that's actually one of the later signs, I would think,
Right. Yes, yes.
right?
Yeah.
Um, versus the first thing that you're going to see.
Yes. So I usually see, the low grade temps. So this is when, if I'm in the house with family, so I do in-home feeding therapy as well as therapy online. And the mom might say, we might have to cancel, baby's having a low grade temp. And I'm like, uh-oh,
Yes.
might be teething, right? Or, lots of drooling. So we're just starting to work on solids and all of a sudden they're starting to drool. That is, two of my biggest signs that I see often that, okay, teething might occur. Irritability, and of course those swollen gums,
Mhm.
baby just being hot overall, being more tearful, more clingy. And then this is where you come in, because then they either want to breastfeed more, which can cause issues because they're just getting ready to start solids maybe, but now they want to breastfeed more. And I'm always telling mom, it's not the food, it's because, they're feeling like maybe they're rejecting food. And I'm like, they're probably starting the teeth. And so they might need to be a little bit more clingy.
Right.
Or they want to eat more because
Right.
they actually want to have that
It's
massage
helping to
onto their
massage those
gums.
gums. Absolutely. Absolutely.
So those are some of the signs of teething that I personally look for. And of
Mhm.
course they relate to breastfeeding and feeding because, it's all within the mouth and the oral structure, and baby's
Absolutely.
just not feeling good. And so just like when we don't feel good, we eat or don't eat, right, to make ourselves feel better.
For sure, for sure. And I know, and for all the moms that are breastfeeding, this is going to go hand in hand. Like Dawn just said,
Yes.
this is it has to do with their oral health. It has to do with their oral experience, which is so much about breastfeeding. It's the point of contact between you and your baby, and so it is going to have an impact on breastfeeding. And sometimes, and I think the same with food. It'll either, like you said, either make them want to breastfeed more or
Yep.
breastfeed less.
Yep.
And it's something that you shouldn't be afraid of, because I think this is one of the things that I hear so much from either expecting moms or new moms who are planning to breastfeed, or are starting out breastfeeding. Like, this all seems okay, but I'm really worried about when they start to get teeth, and we're going to talk about that in a little while when it comes to teething, breastfeeding, and biting, because this is a
Right.
question that comes up all the time.
Yep.
And so I think it's a really good time for us to discuss some of the issues with biting and how to deal with it, and really to not be so afraid of it, because
Right.
children. it's the recommendations are to breastfeed for at least 6 months exclusively, and then to a year as a minimum, and much longer. And children are going to have full sets of teeth when that's happening.
Yeah.
So, and this is the norm. And so you have to remember that this is not something you need to be fearful of. It's part of that natural progression, that those stages that you're going to go through when it comes to breastfeeding. It's just one more thing you'll be looking at that's happening, and totally normal and really manageable, really
Yes.
manageable.
Yes.
Okay. So I'll talk about that in a minute. What I'd like to do is, now that everybody's jumped on, let's give them the secret word. All right. That secret word.
Yes.
Okay?
Yes.
So if you guys want to enter today to win both the Baby Buddy Brilliant Oral Care gift pack, we're actually going to do a pack. Let me see if I have it here. I don't think I have it here.
Yeah, I have old packaging, so there. Okay, you have it. Good.
It's all packaged. Okay, it's a really nice little bundle of the wipes. These are the tooth tissues, and it has the little finger toothbrush, and it has the baby toothbrush. It just has everything to get started and for those first few months. And you'll get one of those. And then also, someone's going to win the new Hush Even Flow Advanced Double Electric Breast Pump. Okay, so we've got a big prize for you.
Nice.
Here's how you win. Okay, so one is you're going to love this post. Okay, love this post. Two, you're going to comment here during our live stream today at one point on each one of these products if you'd like to enter for either, and tell us what you love about it. All right, tell us what you love about either the Brilliant Oral Care Bundle or the Advanced Double Electric Even Flow Breast Pump. Tell us what you love. And then I want you to comment with the word baby. Okay. And if you already did that in your messages and your comments already, you're probably already getting my message. So just type the word baby. And once you type the word baby, you'll get a message from me. You're just going to have to respond with the word baby again, and then you'll get entered. Okay. And Stephanie's going to be going through all these entries, and we will have winners by the end of our show today. All right. So it's going to be somebody who's here with us live. So make sure you stick around. Okay. Make sure you stick around. And I see Noelle from Brilliant Oral Care. She's in the chat. Hey, Noelle.
Hey, Noelle.
Noelle was with us back in August when we did a live stream together, and she'll be back again. Very exciting. She's here. Everybody say hi to Noelle and type the word baby. All right. And if you want to jump in, now's a good time. If you want to ask a question, click the button and come on in, right? We're fun to hang out with, right?
Please do it. I love this part.
All right, don't be afraid. Click the button and come in and hang with us and ask your question. Let's talk a little bit about, we talked about the signs and symptoms, right? Some of those signs may not be as obvious too. When you talk about like baby might have a runny nose, even diaper rash. It's very common for a baby to have a diaper rash when they're teething, and it's not where you would think. You're not thinking that, oh, diaper rash, let me think of their mouth, right?
Right. Totally.
But it really can be one of those signs that baby's going through those kind of teething issues. And Belinda just jumped in. Do you want to grab her? Let me grab her before she jumps back out again. I don't know if she's having a problem. Belinda,
and as you're doing that, can I continue to comment on the diaper rash thing?
Absolutely.
So mamas, know this, whatever goes into the mouth has to come out the other end. And if you think about that coordination of the mouth to the bottom, if you start thinking about that now, then it'll continue to go through when you start solid foods and you start looking for like food allergies. You're gonna need to have that connection. Diarrhea, constipation, all of these things with picky eating as the baby gets older and older, with these symptoms for GI issues that go with the bottom, they all connect. So if you start thinking about that now with diaper rash and teething, it sounds crazy, but have that mindset of that. It's going to make it so much easier as your baby grows and develops, because it all is connected. I teach potty training classes, and I always say, start here. If you think about teething and diaper rash and issues with GI issues, then it's going to help if you maintain that thought process throughout.
Definitely. I just realized something. I never turned on the comment. So if you type the word baby and you get a message, it's my fault. Oops. Boo-boo. Okay, so with all this talk about it, and then I never turned it on. Okay, so I just turned it on. If you didn't get the message, just type the word baby again right here. Okay, type it again, you'll get the message. And if all else fails, because Facebook, you know, there's also a link in the post. Okay, so I've covered my bases, except, you know, remember to turn it on. You do have to turn it. You do good and then you forget to turn it on. So make sure if you want to do it, you just type the word baby again. That was my mistake. And also there's a link in the post if it doesn't work. Okay, so nobody freak out. All right, let's bring Belinda in for a minute.
Okay.
There she is.
Yay, hi.
Hi, Belinda. Can she hear us? I don't know if she can hear us.
Can you hear us, Belinda?
She can't hear us. We see her and we can see your baby, but we can't hear you. How do I tell her? Okay, now she's muted. Unmute. Okay, Belinda, you're on.
Okay, glad I figured this out. Okay, so my question is, my little guy just turned 4 months old, and he's been doing this for about a month, maybe more, where he will be sleeping, and then all of a sudden he'll be crying, and it's a high-pitched scream. It's a scream of "I'm in pain." And I'm like, okay, what's going on? Are you hungry? I make sure that, you know, he doesn't have anything hurting him. His diaper's fine. What do you think that scream would mean?
So between 4 and 6 months is the biggest time frame that I actually see teething start to occur. And clinically, a lot of the families that I work with say, my baby's fine during the day with the teething, except for the drool. It's the evenings and the night times that are the most painful. And that goes with everything. And Shari can chime in here.
Yeah, totally.
Growing pains tend to happen in the evenings because we're resting and our bodies are starting to recover. So all this growth usually happens in the evenings, and teething is no different. So these growth patterns are happening usually during the evenings, and it can be extremely painful. And so, Shari, do you want to comment more on that?
Yeah, absolutely. And, you know, it could be that he's in pain and that, you know, that's waking him up from a sleep. He's scared. He feels something that he's not felt before, and it's kind of, you know, frightening. And it could also be that, you know, he's, as they get older, they can sometimes their reactions can get stronger. You know, they're less about just what their needs are and more about personality too. And so sometimes it could just be like, hey, I'm alone here, like pick me up, you know, and it could be just, they can get stronger. I've noticed that with older children, sometimes the screams are just so much more dramatic. Okay, so that could be happening. But that's possible. When you go to feed him, when he cries like that and wakes up, does it seem to work?
Sometimes, not all the times. I just pick him up and it hasn't happened a lot, and I don't remember the last time, but it happens often enough that I'm like, what's going on? But if I just pick him up, he settles down for the most part.
Yeah. So, you know, I'm watching him as you're talking, and his hands are going to his mouth.
Yeah, exactly.
Since 2.5 months, and so
yeah, you know, it's a process. Teething's not an event.
Right.
You know, teething it's a process, and it happens over a period of time. And then there's ups and downs and times when, you know, teeth are erupting, not all at the same time. And so you're going to see that, you know, you're going to go through these like cycles where they actually, they start and then it stops and then it starts again. And it's just one of those, again, those developmental things that you're going to experience through this first year and even beyond.
Yeah. When people talked about teething, I thought it was, you know, it's like a couple of months. Right. When I was younger, and I've learned, oh no.
Right.
12-year-olds' teeth, technically, with their 12-year-old molars. I remember getting mine. They were painful. I was like, what's with all the bloodiness? Oh, molars.
Yeah. Totally. And then you have teenagers, and then their wisdom teeth start to come in or not, you know, and so you're dealing, I hate to tell you, ladies, we're going to be dealing with teething for quite a while.
Yes. Yes. But the good thing is that you're doing all the right things. So let me just tell you some of the things from a developmental and cognitive standpoint that you're doing right. He's screaming and crying and you're coming in and you're consoling him. So you're already setting the stage of trust with that, which is so important. So he's saying that he's in pain, you're there for him, and you are communicating with him and picking him up and consoling him. Some of the things that I like to tell parents to do, and some of the language use I like to tell parents to do, is actually start to let baby know what baby might need, because receptive language is really skyrocketing right now during this time. So you can say something like, oh, you're hungry, or, oh, you need your teether. So he starts to learn hungry, teether, you know, whatever vocabulary words that you want him to be able to continue, because of the fact that he's going to be going through this for a long period of time. And it might end up being some of the things that he will actually say. So if it's a teether, then you want to be able to say, oh, you know, maybe you want your teether, and be able to give that so that he's starting to have that naming ability. Or maybe saying that he's hungry. So then what he's going to be feeling is that, oh, mommy's saying I'm hungry. Okay, I'm going to eat just a little bit. And then now I'm going to feel better. So from a language standpoint, our words are actually going to help that too. So when he's a 2-year-old and he's going through more teething, you can say, oh, maybe we should have a snack. And he's going to feel like that's comforting enough.
Yeah, that's true. When I breastfeed, and particularly when I'm out in public, I'm like, hey, what's going on? Are you hungry?
Exactly.
I try feeding him, and sometimes he's like, oh yeah, sure. And other times he's like, that's not what I want. And he totally fights me on it. And it's like, come on, kid.
Right, right. Because he's starting to learn that word, that vocabulary word. Again, that receptive language is becoming really strong. And so if you continue to say hungry and offer him that, sometimes you'll see him start to have that behavior if he's not hungry, right when you say the word, are you hungry? And then more screams occur because he actually that's not what he wants, but he's learning that vocabulary word. And so he's knowing, hey mom, I totally understand you, and that is not what I want. So you're doing all the right things.
So I do have another question, Shari. Can I ask another question?
Absolutely. Go ahead.
Okay. So last time I asked you about, you know, the delatching constantly and, oh, he might need a burp. Well, I've tried that. I've taken him off. I've let him burp. And then I'm like, okay, are you still hungry? And he acts like he is, you know, and he moves his mouth, he roots for it, but then he doesn't want to go back on. And he, you know, and he just kind of, he goes on for a minute and then he pops back off and he goes back and forth. Why is that? Because he's not needing to burp.
So whenever you ask questions like this, I can only give you what could be happening. I can never give you a definitive because I can't tell exactly what he wants or not. I'd be a multi-millionaire if I could tell you exactly what your baby wants all the time. But I can offer that if it's not the burp and you're getting the burp out and he's still doing it, you said he's 2.5 months? 4.5 months. Okay. So what I'm gonna guess, okay, is probably happening at this point is that it's very common for moms to not realize that the feedings are going to continue to get shorter and shorter and shorter. And so this is what I hear is I'll hear, oh, everything was fine and the baby was eating fine and the baby ate for 15 minutes or 20 minutes. And now the baby's not eating enough. I don't think I'm making enough. I don't know what's happening. He'll only eat for like 5 minutes. He can't possibly be getting enough. And I'm worried. And then I supplement. Okay. So what I want to say to you is if it's not the burping, the very next thing I would go to is that the babies become very, very efficient. And so that 5-minute feeding that you're like, okay, well, you just started, like finish. And he's like popping off and not wanting it is because he's actually done. And I know that sounds crazy, but it's actually awesome because the feedings really do get easier. And, you know, for all of you guys, I know a lot of you know that I finally launched the Simply Breastfeeding program this week. Monday was the official release of it. And that's a free full-length breastfeeding course for all of you. It's my gift to you. And I hope you're all checking it out. I'm going to actually show a small clip of it today while we're doing the live stream so you can see something, you can see a little part of it. But in the program, I talk about this, you know, and what's really happening is that, you know, you've got to get through that hump of breastfeeding, you know, and that's really when I really boil down to what it is that I'm going to be teaching you is really how to get over that hump. And that hump means those first 6 to 8 weeks or so, you know, maybe a little bit longer, but it's that time when it's just really hard. The feedings last forever. You feel like you're cluster feeding. You're going through those first growth spurts. It's all that getting, you know, getting it all working out. Okay. And then we get over the hump, and it really is a hump. It starts off like this, and then it peaks, you know, and then all of a sudden it starts to get better. And the reason I'm bringing it up is because when we get over that hump, one of the great, amazing things is that the feedings go quickly usually. You know, and if they're not going quickly and the feedings are continuing to take a long time, it's actually something I would look at. I would start to look at, does a baby have oral ties? Is something going on that would cause your baby to be taking so long and so much energy to feed? All right. And what I would expect is a 5 to 7 minute feeding in a baby your baby's age.
Okay. Yeah, I think he does eat about that long. So I think he's going through a growth spurt. I mean, I think he just nursed for about 30 minutes right before your video started.
Yeah.
Great.
So he was just, well, and
it depends on the time of day too. Okay.
Yeah.
There's going to be times where he's going to linger and nurse longer. There's going to be times where he wants a quick snack and he's out of there. And they're also getting very curious. You know, they start to really notice their environment around them. And so it's not just that they're not as focused, or I would say like they're just, they tend to like my oldest daughter, you know, my 2 kids were really different, but my oldest, Jade, she would nurse and it turned into like 5-minute feedings on one breast. You all know she nursed on one side only, refused the other side. I'd nurse her 5 minutes. And the minute she was done, it was like, she'd literally leap off my lap. Like she was like, wouldn't even look at me. It was like, you know, wham, bam, thank you, ma'am. And she was out of there. She's like, what else can I go do? Very curious. You know, my other daughter loved to linger. And I remember days where we would watch movies, the whole family, and she would nurse for like 2-3 hour stretches. And I'm just looking at her, I'm like, you're so not interested in the movie, but you know, like there's nothing left. But she'd smile at me. She just liked to linger. And so babies go through these phases and each baby's different. But I would say to you, don't pay attention to how long the feeding is at all. It's telling you nothing. Remember, in my course, I talk about don't watch the clock, because the clock tells you 0 about the feeding. Okay. And that includes like short feedings. So watch the baby, watch for is he still hungry? He'll stay on and eat. He's smart. Believe me, he's smart enough to know when he's hungry, he's going to stay on and eat. If he's pulling off and not wanting to eat, then he's probably not hungry anymore. Just wait till the next feeding.
Well, and it's harder to feed him in public. Like he's not as wanting to eat. And so whenever I go out and run my errands, which is one full day, which is Tuesday, so yesterday, and he eats one time, a short time, and then he's done. But he's happy. He doesn't complain. He's fine. So I'm thinking that since, you know, my shopping days are harder on him, you know, like today, he's going to eat a bit more to catch up from yesterday.
It's very possible. It's very possible. You'll see that he'll eat more on the days when you're home, you know, paying attention to just that. And yes, he'll be more distracted. But awesome to see you, sweetheart.
Oh, thank you for all your help. And
oh my gosh, have you logged in to watch the course yet?
I haven't. I've been meaning to.
Okay, I can't wait for some of you guys to start watching it. I want to see that. I want to hear what you think about it. I'd love all of your feedback. When you get to chapter 12, which is at the end of the program, there is a survey. Please do me a favor, fill it out completely and give me the feedback, honest feedback. I really want to know, because this is all about creating something that is going to help millions of moms all over the world. You guys are the first to see it. And so any feedback you give me gives me the opportunity to just keep making it better.
Okay, I will. You know what? You've helped me out so much. I can help you out and help out all the other moms.
I appreciate that. And share it with other moms that you know, so they can all get the benefit. Anybody who can watch this program while they're expecting will have such an advantage over anybody who doesn't. To get off with the right information and knowledge and support and confidence, that's the most important thing.
Yeah. I mean, I didn't know a whole lot. I don't have my mom in my life, but I knew going in to having him, I knew what I was doing. I knew what breast pump to buy. Like I just felt more empowered. And so
That's
thank
it.
you.
I have goosebumps because that is everything to me. That is exactly why I do this.
Well, I will jump off and let somebody jump in.
All
Thank
right,
you.
sweetheart. Have
Nice
a
to
good
meet you.
one.
Bye.
Happy Halloween. We want
Bye.
to see pictures of him in his
That's
costume.
right. Yes.
Okay.
All right. Bye.
Bye.
All right. Oh, so cute. So cute. And it makes me so happy to know that what we're doing here is really, really helping moms to succeed. And this class is going to even do that even more. Okay.
Yes.
Dawn, before we even go on, I'm going to show a little clip of the class because it actually talks about, let's do this because there's a piece of this. It reminded me when I was going over some of the stuff that we wanted to talk about today when it came to teething and breastfeeding, that brought up one part of my course in chapter 7 where I talk about the baby's latch. And so let's really talk for a minute about breastfeeding and teething and biting. Okay.
Yes.
Because this is a topic that comes up so often, is the idea that, my baby's going to bite. The thing that I would say about this is that, you need to remember that breastfeeding is not nipple feeding, okay? It's breastfeeding. And I talk about this in the program. And what that means is that your baby is taking more than your nipple into their mouth. And so when a baby is breastfeeding properly, when their latch is good and deep, it's impossible for them to bite, honestly. It really is, because the nipple should be far back in the baby's mouth enough where they can't actually clamp their teeth down. All right. They need to come with a nice wide open mouth. And so when that's happening, and their tongue is covering their lower teeth, okay, or their lower gums, they're unable to bite down. What you'll normally see if your baby is biting is that it doesn't happen during the feeding, but at the end of the feeding.
Right.
It's when we linger. It's when we don't recognize, like Belinda was saying, the baby's pulling off, the baby's done, okay, and not recognizing the end of that feeding. And then that's where you'll have, especially with a teething baby, where they're going to go ahead and then they'll clamp down. And so I want you all, if you're experiencing biting, or if you know that your baby's teething, just recognize that this may be a time when they do try to go clamp down, because they're trying to massage those gums and they're doing it on whatever's in their mouth, which happens to be your breast. To really pay attention for when those feedings are getting close to the end. That means that you're not hearing swallowing at the same rate anymore. And go ahead and remove the baby, or make sure you're holding the baby close enough to your breast, okay? Hanging off to the tip of the nipple is going to cause that baby
increase
your risk, okay, of your baby actually clamping down with teeth, okay? So holding the baby very close. And, when you first start breastfeeding, we're very focused and paying attention on the latch and holding the baby close, and you'll see that in the program. And then as the weeks go on and the months go on, your nipples are used to it, the baby's kind of doing their own thing, we tend to be a little more, I don't want to say the word lazy, but it's like you don't have to focus on it so much.
Right.
Our latch can get a little lazy. Teething is a time when you have to go back to the basics and go back to the beginning and focus on that latch and hold them close and get into positions that will actually cause the baby to keep their mouth wide open. If you're not,
one bite later, you will be focused.
Exactly. And, babies are smart. What I would recommend that is, if your baby does clamp down, what I would do is, first of all, insert a finger into their mouth so that you can break that seal and remove your breast. Okay. Do that as fast as possible to prevent as much injury that can happen to the breast. And then, try to stay calm. You want to say no biting. Okay. But you don't want to do it in a forceful, angry way. All right. We want to just be calm, and we don't want to create a lot of drama around it for two reasons. One, it can cause the baby to get scared and even cause an aversion where they want to stop breastfeeding and they won't go back to the breast. Or for some babies, they saw a reaction, and it's a way to get a reaction from you, and they don't really understand that hurts. So either way, you want to just stay very calm and almost keep the reaction boring, if that's the right way to say it. Like a bored reaction, but firm. No biting.
And I'd add on to that exactly how saying the word biting, and the reason why that's so important is because of the fact that we, again, want to make that vocabulary word something that they are going to start to recognize. And so that's what I teach is I say, we are going to label it exactly what it is, and that is biting. When you insert the finger into the mouth, you want to make sure that your finger is on the gum line. So it's actually going to stop that. I have parents remove the breast and then actually stick in a teether. So when your baby is teething, you want to have that teether handy whenever you start breastfeeding. And usually I see the biting and the clamping starting at the beginning of the breastfeeding, not so much at the end in my experience, but and what I like to do is do some teething massage with a teether, or do some oral care before. So then then the massage and everything's already kind of happened, and we make that be kind of a program. As you know, when baby starts to fuss and let you know that they're hungry, you can implement an oral care program, implement a teething program, and it only takes a minute. Just have baby get in there and just massage those gums and then offer the breast. Because what happens is it decreases that sensory awareness and lets baby know that you're communicating non-verbally that, hey, I know that this is uncomfortable and I'm going to massage this, and then we're going to feed you and give you all the abilities to be able to be successful with that.
I love what you're offering, Dawn, because it's really like it's more coming from a preventative, anticipatory approach versus a reactionary approach to biting. And I think you kind of need both, because you may be anticipating it and it may catch you off guard. So you kind of need to have your plan for both. But if you can actually massage your baby's gums, have that teether ready, anticipate that beforehand, and you know this has been happening. I love what you're offering to everybody, to like kind of do some prevention.
Yes. And then my technique to get fingers in and out of the mouth, I'm just going to show you. It's kind of weird seeing it on me, but I want to be able to show moms how to be able to do it. Because if you learn this technique with a teething baby that has one tooth, if you continue to breastfeed and you have a toddler and they have a whole bunch of teeth, you're going to want to know this technique. So I teach this nationally because there's all kinds of biting issues when it comes to starting solids. So when you take your breast out and you stick the finger into the mouth, you're going to want to put that onto the gum line, right? And then you don't want to pull out. What happens is when you pull out, babies initially want to follow that and actually are going to continue to bite harder. It initiates a reflex for them. So what you want to do is you're putting your finger on the gum line and you're going to roll out towards the gum and then take it out because there's no more teeth there. If you roll in, you're going to get bit even worse. So gum line, roll out to the cheek and then come out. And that is the technique that I teach for all issues of teething, because of the fact that you want to, if baby is trying to bite their sibling or, or your breast, whatever it is, you want to be able to get your finger in there really quickly and then remove it and then offer a tangible option, which is a good teether.
Totally. I'm going to pull out some of the products here from Brilliant Oral Care.
Yes.
I want to ask you, this is their this is the baby toothbrush. Baby toothbrush. And this is something that's great for them to be able to like start.
To be able to massage those gums. And this is what I use preventatively beforehand to be able to get that. But it's also a wonderful tool to be able to supplement, right? So as I said, you take the finger out of your mouth, you can use that to be able to help baby feel like they can chew on that a little.
Got it. I guess it would also help to prevent your finger from getting bitten too with some of these toothbrushes, right?
Absolutely. And you can have that on while you're breastfeeding so that it's something that you can immediately put in. The thing is that when you use that, if you're using it in the way to be able to help not get your finger bit as often, once babies feel silicone, because it is a sensory product, they want to bite on it.
Right.
So
I think I would want to bite on it.
Yeah, they're awesome. I've actually bitten on all of them. Right. So I would use the baby toothbrush over the finger one. The finger, I use it to be able to help, again, preventatively teething. Using that finger, it does protect you. So if moms, you're you want to use that so that you can continue breastfeeding, then absolutely do that. But know that that silicone, the babies really want to be able to give that pressure. So it might actually increase a bite reflex, but at least they're not doing it on your breast.
Right. Let's talk for a minute about teethers and about, you know, there's moms will talk about using washcloths and all kinds of, can we talk a little bit about that?
Yes, please. So,
and then I'll come back to show the clip later.
Absolutely. Perfect. Okay. So, one of my biggest tips is to avoid using washcloths. Now, well-meaning medical professionals and other moms and well-meaning blogs tell parents to use a washcloth, put it under some water, freeze it, or just offer it really cold. And I did a whole bunch of research on this. I worked at the hospital, and I would actually go in when babies were having difficulties transitioning to solids, and they were sick constantly. Mm-hmm. So what I did is me, a pulmonologist and a respiratory therapist, would go and do an invasive procedure and checking out babies' throats to kind of see why babies weren't eating. And we were pulling out tons of lint. Think for a minute, you guys, of dryer lint. That was what I was pulling out of these babies' throats. The throat muscles are not really smooth. They have all these caves and crevices where lint and pieces of string from those washcloths get ingested. And of course, it develops bacteria and the throat swells, and all of a sudden we have decrease in breastfeeding, we have decrease in wanting solids because it doesn't feel good. So I tell parents to avoid using cold washcloths because of that. And when parents actually stop doing it, they actually see that all this actually resolves. So eventually I have parents feeling out like, oh my God, I've been using washcloth for 2 weeks, you know, my kid's gonna die. No, eventually the body will help with that. But if you discontinue it, if you continue the use, and of course it builds up, and then there's more lint, just like, you know, if you wash several loads of laundry and you don't clean out your dryer.
Right.
So it's really important for us to avoid that. It's one of my biggest tips when it comes to teething, because I find that if babies need to be able to teeth, they really want to be able to put a lot of pressure to, and a washcloth just can't provide the pressure that they need anyways. Absolutely. So that's 1 out of 4, but I don't know if we want to go into 3 other tips, or we can do that later, however you want to.
Let's do it. I mean, I think this is the time when they can actually learn what to, you know.
Sure. Okay. So then one of the other things that I tell parents to avoid, my 4 tips of having teething support feeding. And so we want to avoid these mistakes. So to be able to help with teething that actually helps with starting solids. So I don't like to use my own fingers, and I try to encourage parents to not use their fingers. And if they do use their fingers, just make sure that you wash your hands, especially during these winter and fall months when all the flu bugs and all these things are going on. Just wash your hands before you start breastfeeding. Wash your hands if you're going to implement any oral care, and keep your nails trimmed. It's really important for that to happen because bacteria grows underneath our nails, and we just offer that to baby without really thinking about it and knowing it. So I just tell the families that I work with, just make sure that you trim your fingers and keep your hands washed if you're going to use your finger.
And it's really like with anything else, the most important disease prevention and infection prevention is hand washing. And you would be really surprised, you know, like we think, okay, we're using the bathroom, we're using a public bathroom, we wash our hands, and then we go back into like, we're in the supermarket and you're touching the handle, and there's actually more bacteria there than there was on the toilet seat. And so you just got to be really aware, you know. For me, I'm like a nut with that because I was a surgical nurse who worked in the OR when I was in labor and delivery. And so I'm just very aware, but for the majority of people, they're not that aware of like when you touch something, how much that really can spread infection, and especially with a baby when they're vulnerable like that. So
totally. And so much so that, again, you know, these are tips to be able to help, you know, support teething for feeding. I've had a lot of moms not realize that they had a little bit of their peanut butter and jelly sandwich that they were trying to you know, multitask, and then they stick their finger in their mouth and their baby ended up being allergic to peanuts and all this huge reaction. And it's all because there was no hand washing, and then not being able to figure out what that was. So, and taking us a couple months to actually figure that out. So anyways, that's one of the things that I like to avoid is using a finger. So I like to use, you know, Brilliant's products to be able to help with that. So that's another wonderful way to be able to do that. And when you actually decide to put on that baby toothbrush on your finger, it's a nice reminder of, oh yeah, I probably should wash my hands, because it's being able to allow, you know, your finger to actually be in there with a little bit of enclosure, but it's another way to make sure that you wash your hands. Then my third tip is to decrease the overuse of counter pain relievers. And this, although I see this all the time, again, on well-meaning blogs, I have had so many kids have allergic reactions to this. And then what happens is that the way that you actually implement it too, I've had parents put it onto their breast and
we're talking about like Motrin, Tylenol,
or any of the teething gums, any of those meds. I've had moms say that, oh yeah, I put it onto the breast and then I put my baby onto the breast and then all of a sudden baby doesn't want to breastfeed anymore, right? Or they put it onto their finger, or they put it onto the tip of a bottle or a pacifier, and then all of a sudden the baby doesn't want that anymore, or they put it onto the teether. What happens is that it breaks trust. And so again, all of these are supposed to be comfort items and food-driven items, and it breaks trust. The other thing that it does is that kids have allergic reactions to a lot of these things. And really just being able to breastfeed and being able to give good oral care usually decrease 80% of that. So I've recommended to not use that just because of the fact that there's just been so many reactions, and I've had so many kids be hospitalized because of that, when really it was just 5 minutes of teething, you know, regimen that really mom could have avoided. And then the last tip is to avoid fluid filled teethers. I've had if you've seen them, they're teethers and they have water in them and you freeze them. I've had a baby bite down and have that explode. And if you believe it or not, that's toxic material. Which I don't even know how that is safe in this country. But
chewing on it.
Exactly. It's toxic. I've had them crack, and because you're freezing them, and I've had them cracked, and slowly but surely baby's ingesting that material. And it's big, it's bulky, and it's really heavy. And I don't like anything heavy into the mouth because the oral structure is changing during feeding, and we don't want anything heavy inside the mouth. If you flip that, you know, silicone toothbrush is light and flimsy, and it's really soft and really gentle. But you know, I don't really like those fluid filled teethers because of the bulk and the heaviness. They need something to be a little bit thinner, something that's really going to get into the gums. And so those are my 4 tips to have teething support feeding.
Dawn, there are other methods that people are using beyond the over-the-counter analgesics for teething.
Yes.
You know, things like the amber necklaces.
Yep.
Or homeopathy. Can you talk a little bit about the necklaces?
Yes, absolutely. So those have been shown to be able to help minimize the inflammation and actually calm baby down. And that's what's something too that we need to be able to balance, is not only are we trying to balance the pain and keeping the trust, we also want to make sure that baby knows that they can not have to be so anxious. Because what ends up happening is that if babies tend to get into these screaming fits when they're teething, they're going to tend to scream to be able to get attention. Because they are like, well, mom always comes when I do this piercing scream. If they actually develop ways and feel calmer during this, they can still be able to communicate effectively. They just don't get to that high pitch. And why that is so important to be able to have some of these natural calming methods in place is because, again, as babies grow and start to be able to communicate and also be able to tolerate pain and also tolerate stress and anxiety, that's going to really help when you start solids. There's a lot of research that says that if babies are anxious at mealtime, they eat 50% less. So we want babies to be able to be calm, and using these natural methods, I love them because it actually does help baby remain calm and actually be calm before they get into that anxious state. And so then they tend to be able to eat more. They tend to be able to build trust with those caregivers, because not just with you, mom, but anyone else that is watching baby, they need to be able to have those methods of calmness that are not mom's breasts to be able to assist with that. And so I love amber necklaces and homeopathy.
I would say this, you know, there you're going to have these are a little controversial, and you know, the AAP doesn't necessarily recommend them. There have been safety issues with them. We're not talking about whether they work or not. That's sort of anecdotal. I don't know if there's that much research, because who's doing the research really? It comes down to, like, you know, what works for moms, and if it works for you, great. But here's the warnings I would just say about that, is making sure that you know, there's been children who have had strangulations from those necklaces. I want everyone to be very aware and careful. You know, release latches, that they're not all made the same. They need to be fit properly. They need to have the right kind of release. And the beads need to make sure that they're not going to be a choking hazard either. So do a little research about this. And I'm bringing it up because I know that people are using them, and that people have success with them. But people also have had children die using them. And so we need to say both. And it's like anything else. It's about safety. It's about knowing what you're buying, about knowing the product, right?
And the biggest thing with that too is monitoring. So with the families that want to use it, I was like, you're using it during that teething period, and you are putting it on and taking it off. A lot of these families who had issues, the baby was wearing them 24 hours a day. And again, it is a tool. It's a tool that is to be used. And when families want to use it, I'm like, it is something that you put on and off. Anytime that you are changing the baby's diaper, changing the baby's clothes, consider taking that off or on, depending upon how you're using it. It's a tool.
Absolutely. Absolutely. No, that's a really good point. And then when we talk about homeopathy, you know, again, warnings and stuff around that too. I'm going to straight out say that I love it. And,
I love it.
You know, and I know Dawn loves it, and it really, it can really, really work for your baby. And you know, I would say, again, you're going to make your own decisions about this. We had a great conversation in our private group around, you know, teething tablets and the use of them. I definitely use them with my own children, and I've seen a lot of really, really good results in homeopathy in general. Just my opinion, just saying, okay, you choose what you want to do with your own kids, but I want to just put that out there as something that has helped and worked, right? Yes. Dawn, let's for a minute talk about, let's just come back to the prizes for a second. Okay.
Yes.
Everybody type the word baby, because these are some great prizes. Noelle from Brilliant has been here in the chat with us, and she's been answering questions and just creating and providing such great information. We're going to have Noelle back. She's amazing. And then Even Flow Feeding, we're going to be giving away one of the double electric breast pumps. And if you watch my program, you're going to see many, many cameos of the Even Flow breast pump, because that was the pump that I actually helped to design. It has all the features that I recommend for pumping and nursing moms to use. It's a fantastic pump, and there's some surprises coming that I can't talk about yet, but someone's going to win the pump. All right. So I want to make sure that you all, can I play a clip? I have to play a clip. We may go over for a few minutes here, but I want to play a clip. So let me see if I can do this here. Okay. So we're on Zoom. So what I have to do is share my screen. Hold on one second. All right. We're just going to play a clip here. And it does relate. It does relate to, Dawn, can you see this?
Yes, yes, okay. I can.
It does relate to the conversation today, all right? And this is all about what we were just discussing when it comes to biting and when it comes to teeth, and what does it mean to have the right latch? So let's just play a little bit of it. This is chapter 7.
I'm so excited.
So far, we have discussed many things about the why and the what of breastfeeding and breast milk. It's now time to discuss the how, so you'll be prepared when you're finally ready to put your baby to your breast. When you listen to other moms that had difficulty with breastfeeding, they'll usually give you two main reasons. It hurt too much, I just couldn't do it. Or I just didn't make enough milk. The latch is so important because it is the point of contact where the breast milk transfers from you to your baby. Slight differences will impact how fast the milk comes out, how much they're able to remove, how comfortable breastfeeding is for you, and ultimately, how much milk you will make. If you're not latched right, your nipples can become very sore, and that kind of soreness can definitely lead to giving up early. And remember, before we talked about supply and demand, which means that the more that you express from your breast, the more milk you'll make. Well, if you're removing less due to infrequent feedings or an improper latch, your supply will decrease. Although some moms can be a little more sensitive while their nipples are getting used to the baby sucking every few hours, especially at the beginning of the feeding, it's not normal to be in pain when your baby latches. Now, I know there are breastfeeding moms and even professionals that disagree with this, claiming that pain is normal in the beginning. You have to just push through it. It'll get better with time. And while this is true that it may get better with time, more practice, and more experience, it often does not without proper instruction. It is not normal to feel pain while breastfeeding. Pushing through it and ignoring the signs your body is giving you will not only make breastfeeding your baby a negative experience, which it shouldn't be, but can often lead to real problems. Prolonged feeding sessions, insufficient weight gain, dehydration, sore cracked nipples, blocked ducts and infection, low milk supply. All can be a result of an improper latch. So how do we get the baby to latch well? What does that even mean? To begin with, we need to understand basic anatomy. This is your breast. This is your nipple. This is your areola. When we refer to the nipple, we're talking about the part where the milk comes out. When your baby latches, they are not latching onto the nipple, they're latching onto the breast. After all, we call it breastfeeding, not nipple feeding, right? If the baby comes to the breast and latches only to the nipple, the tongue will compress the nipple directly against the hard palate. This will cause pain and also make milk expression more difficult and ineffective. In fact, when the baby is nursing correctly, the tip of your nipple is way back in the baby's mouth and not being sucked on at all. With a nice wide mouth and the nipple pointed towards the roof of their mouth, the baby pulls the breast in so that the nipple ends up back to where the hard and soft palate meet. This will trigger the sucking reflex, and your baby will begin to suck using their tongue to compress the ducts below the areola. This compression gently pushes the milk out and into the baby's mouth. While you may feel some discomfort when they initially start, once the nipple is in the right position, far back in the baby's mouth, there should be no pain. Use your tongue for a moment to feel how far back this really...
All right.
Nice.
There you go.
Nice. Looks great.
All right. So I wanted to show that clip specifically in relation to what we're talking about here today. When it comes to your baby's teeth and biting and teething and breastfeeding, they shouldn't be connected in the sense that if you're latched the way that I just showed you, where the nipple is far back in the baby's mouth, you can see it's nowhere near their teeth. Okay. Right. And so I just wanted to really make that point while at the same time, you know, giving you a clip of the new program since we just brought it out this week. And hopefully you're going to get so much out of watching it. That was just one little part. There are 12 chapters to this program, and I know you're going to really, really enjoy it. Has anybody seen the program yet or started watching it? If you have, I want to hear from you here in the chat. And I'd love, again, like I said to Belinda, if you watch the program, please make it all the way to the end and fill out the survey for me. Give me the feedback that I'm looking for. We'd love to just keep improving and bringing more. And there's a lot more coming. So you'll hear from me in the next few months over what's coming here. Okay. So Stephanie's telling me that they're drawing the winners now. Okay. So awesome. If you didn't enter yet, hurry up. You still have a chance. Type the word baby and tell me what you love about the Even Flow Advanced Double Electric Breast Pump and also all the amazing products from Brilliant Oral Care that we've been discussing today. This is all the products that you'll need to really help your baby to have the best oral health care and start from a very young age. I mean, Dawn, we want to start this early with our babies, right?
Absolutely. Absolutely. I start implementing an oral motor program and an oral care program at 1 month of age. So
1 month. There you go. So
start getting,
we're not waiting for teething to
No.
start this. And I think that's a really important point that we may not have said. Okay. It's a myth. We're
Yes.
not going to wait till your baby starts teething to start implementing an oral care regimen.
Right.
And that's
because
important.
We're cleaning the gums. We want to take the bacteria off of the gums and off of the tongue. And what I find too, Shari, and I know this is like, you know, flipping to other topics, but I find that when I teach parents how to do an oral care program, then all of a sudden they're like, I think my baby has a lip tie. I think maybe it has a tongue tie. Like they're getting in there and actually starting to really look into their baby's mouth. And it ends up being a habit. And these moms know the day that tooth erupts because they're into the habit of doing the oral care. So it's just being able to set the stage, right? Nice and easy at the very beginning. And another thing is that, you know, brushing a baby's teeth early and often gets them exposed to it, so that you don't have that 2-year-old that's just screaming. You know, I've seen those toothbrush videos on YouTube of kids just like freaking out, and I'm like, oh, if they would have had these products early and often, then this would be something that they actually look forward to. Yeah, I wake up and the first thing I want to do is have my teeth brushed. So it ends up being able to help with that. And then of course, you know, teething and oral care helps with feeding. If we have a decrease in bacteria, there's tons of research that says that babies will be able to eat more. They'll want to actually have more fruits and vegetables. It's hard to eat a bitter taste of a vegetable when you've got all this bacteria all over your mouth. So it's so preventative, guys. So preventative.
So preventative. Such a great conversation that we're having here. And I just want to thank Noelle from Brilliant Oral Care for joining us in the chat. Such an amazing partner and providing such great products here. Also to Even Flow Feeding, you know, my partners in creating products that really help you guys to be able to extend and reach your breastfeeding goals, you know, for as long as you want to, whether it's the pump or even their storage bags and everything else that they make. They just make such great quality products. And I know so many of the fans are here in the chat and loving it. And so we just give it, Francine Lilly is the winner. Congrats, Francine. She just won the pump. And
good prize.
Nicola won the oral care kit.
Congrats.
Woo! Okay, and for anybody else who wants to get the pump, whether you want to go purchase the pump or you may be entitled to have it through your insurance, okay? In the message that I just sent you, if you click through to what the prizes are, you'll have links to be able to do all of that, as well as shop on Amazon, and also some discount codes for the Brilliant Oral Care products. Whether you go to their site, there's a 20% off discount and a 10% on Amazon. Just click through to the message and you'll have those discounts to get them for yourself.
All right. Thank you, Brilliant. Thank you, Even Flow.
Yeah, and thank you, Dawn. Thanks for playing with me today. I miss you, and I'm so happy to do this together. It's always the best.
Me too. It's so fun. So fun.
All right, everyone. So have a great Halloween, a safe, happy, and fun Halloween, whether this is your first one or your 10th one with your children or your 20th or your, let's see, for me, it's my 17th.
Woohoo! And make sure to use Brilliant Oral Care products after your kids eat the candy.
What a perfect time to do this, this show right before Halloween. Make sure that you're taking good care of those teeth and cleaning them after all that candy, right?
That's right. That's right.
All right. Goodbye, everybody.
Bye, everyone.
And make sure you go click through all the links. Talk to you soon.
Bye.
Bye.